Good morning, everyone. It's really a pleasure to be here with you today. I'm JoAnne Reifsnyder, and this is Rebecca Kirch. This was just an incredible assignment to work together to put together this workshop. And Lori, where are you? Right? What an incredible force she is.
Yay, Lori.
We would not be here. We would not be doing this without Lori's leadership of the effort. So thank you so much from all of us. I think for so many of us in this room, working with people with serious illness has been a lifetime passion, a lifetime of work, or maybe just feels like a lifetime for some of us. But that's certainly been true for me, 30 years being focused on trying to advance the care of people for people with serious illness. At the same time that it's a professional focus, this is also intensely personal for so many of us right now and for all of us in some facet of our lives. We all face this. So I agree with you, James, that starting with the voice of the patient, it's the voice of all of us, the people we serve, but our experiences as well. And we're really pleased to be integrating them with all of you today. So thank you. Rebecca.
Thanks, JoAnne. This was an interesting workshop to plan, and it was truly a delight. And thank you to the planning committee who's featured here, and to our many speakers, some of who certainly braved weather, but also had to do a lot of sophisticated scheduling and collective bargaining with spouses around taking care of children to be here. It's important because this workshop is really built around putting people at the heart of healthcare. And there's no more important time than now to raise those voices loud and clear in the context of the discourse that's happening. Healthcare value and quality mean one thing here inside the Beltway bubble, but they mean something quite different to the patients and families that we're all working to serve. And I'll give you just one spoiler alert. Among the different diverse perspectives you're going to hear today, I think one common theme across the disciplines, across the geographies, across the age span, is this very important message that people and even professionals, they're really wired. They want to talk about the quality of how they're living until whenever it is that they're dead. They don't want to talk about the quality of their dying, even if they know they are. And so we really took that to heart in thinking about how to frame up this workshop. We've all gathered at a hectic time of year in terms of the holidays, but there is no more important time than now to make sure that we have a lively exchange that elevates what patients and families hold dear in the context of how the discourse goes forward into the new year and the new administration. So I'm very grateful to have all of you here. Thank you. The day starts with hearing from a pairing of caregiver and patient perspectives together with clinicians, and hearing about the whole roundness of how care should happen that includes well just beyond the medicine, spirituality and meaning and what matters to people. Then we're going to move into session 2, which talks about the populations that often get left behind, the particularly vulnerable populations and the disparities that we need to address in health equities to help deal with the challenge of making sure everyone gets care that matters to them. Then we're going to talk in session 3 about the clinical environment and what we can do in the various care settings and communities to make sure that this care happens everywhere. And then session 4, I have to say I'm particularly excited about this because we're going outside the norm to talk with those on the outside coming in to help us normalize the importance of what patients and families want to talk about, think about, and consider when they're making decisions about their disease-directed treatment. So that's a full, wonderful day with a lot of different perspectives. And I think an equally important part of the day is the participation of everyone. There's time built in after each session. That's as important as the speaking session is the engagement of all of this audience, because there are so many rich perspectives that we want to make sure that are shared and recorded into part of this webcast, which is being live webcast. So when folks do come to the microphones, please identify your name and your affiliation. That was the logistics piece that we wanted to make sure we cover, right? So let's get rolling, roll up our sleeves. Oh, and tweeting also. There is a hashtag, Lori, I can't remember it, but I'm sure it's in our program.
It's on our title slide.
Be sure to tweet insightful things you hear, inspirational things you hear, and pictures. So we spread the word. So let's roll up our sleeves, put people at the heart of healthcare, and thank you all so much. We'll bring up panel 1.